Alrighty. Well, it's nice to be here again. I was here last year and we went over a bunch of different topics. This year, we wanted to focus more on what happens to your feet in the wintertime and what kind of precautions and things to worry about during the cold season. So, the topic of our discussion today is cold feet, and we're not talking about wedding jitters or relationship blues or anything like that. We're actually going to talk about what we have to do with our feet in the cold. Can you guys hear me in the back? I'm going to try to scream because this is really as loud as I talk. It's sad, but so with our feet, we all have two of them, hopefully, all of us in here. But as the seasons change, you notice sometimes your feet get swollen, sometimes they're dry, sometimes they can be very sweaty. They can change shape and size according to what we do. Our bodies change. Like if you gain weight or lose weight, if you end up with diabetes, you notice your feet get drier. But as time goes on, you can never expect your feet to stay the same. They are changing. So according to that, we have to change our shoes and change the kind of things that we put in our shoes. So the most common cause of foot problems and why we see you in our office, besides for just diabetic foot care, is improper fitting shoes or ill-fitting shoes. As you've noticed, like maybe for the ladies in here, you guys maybe wore a size 7 or 6 when you were younger, but now are wearing a 9 or a 10. And I'm just a psychic here. But what happens, your feet, they start getting wider, your arches start to fall, they start getting longer, even for men. So your shoe size is going to change according to what happens to your arches, your weight gain and weight loss. So like I said, the foot becomes wider, the fat pads on the heel and the balls are going to become less. So certain shoes that were real comfortable for you are going to change. And that happens to all of us. Even like our work environment, things like that, we have to change shoes depending on the floors. So anybody have feet like this? Maybe you may not want to admit it, but sometimes they're called pancake feet or flat feet. But this is where someone has no arch at all. Their ankles are completely turned inwards. You can see their toes are going outwards. You'll notice when they're walking that their shoes, the inside of their heels, are worn down, and that's an indication that you have really flat feet. Wearing the right shoes is really, really important for us, especially in the wintertime. In the summer, it's okay to wear sandals, let your toes get air to it, have a good arch support in your sandals. But as the winter comes, we have to protect our toes and our feet. Circulation's not as good. People with diabetes, the neuropathy gets worse, and we're going to talk about that later as well. But if you wear good shoes, it's going to slow down the progression of arthritis, ulcers, which are open sores, and amputations, which we definitely want to avoid. And of course, coming to see us in the office. But we like that, so let's see here. So the wrong size shoes can create lots of problems. Here's some examples here. You can get blisters on your feet. You can start to get irritations. You can start to get changes in your feet. You can see the blisters, the first picture on top of the feet. There's a bunion right next to that. And of course, those hammer toes, which knuckle up. Once you start getting bunions and hammer toes, it's not something that you can tape over, strap, pad, do anything yourselves to get it to go back being straight. So wearing the wider shoes and shoes that have more room in the toe box are what's going to really help you to prevent this from getting any worse, but it's not going to correct it. If you ever wanted to correct it, that's a surgery that we would have to do if it's something that hurts you all the time. So other pains that you can have when you wear shoes that are not correct for you, you can start getting back pain. You can get knee pain, and of course, foot pain, and that's what I'm here to talk about today. So one of the first things we're going to talk about, this was a big, interesting topic last time when I came, was neuropathy. And for those of you who don't know, you might experience it and not really know what it is, but it's the feeling of pins and needles, something sharp, shooting, stabbing to your feet. It can go down to your toes. Some people feel it down to their fingertips. And it's just a sensation. You feel like maybe ants are crawling on you, but there's nothing there. You may feel like electric current. Sometimes you're touching something and don't realize you're touching it, and you can't sometimes even tell the difference between something being hot and cold versus something being sharp or dull. So it's really important to figure out when this starts and prevent it from getting worse so that you don't cause more damage to your body and your skin. Some of the causes of neuropathy One of the most popular causes is diabetes. Sometimes it's chemotherapy, radiation therapy can affect the nerves and the sensations. Some people have like injuries, like at work or car accidents, things like that, that they have nerve damage, and that causes it. Severe heart conditions, plaque buildup, that can lead to it. Certain autoimmune disorders, kidney problems, thyroid problems, and certain drugs and medications that we take can also trigger the neuropathy. Diabetic neuropathy, and you can see a picture here. It shows you kind of how nerves send impulses and feelings and sensations to your feet and to your toes. And like I said, it's shooting, burning, pins and needle pain. It's a result of damaged nerves. So nerves over time, especially if you've had diabetes and it's been over 25 years, you're pretty much almost 90 to 100% bound to get some sort of neuropathy. And that's because long-standing diabetes starts to affect your blood vessels, starts to affect your skin and your nerves. People who get a lot of swelling, the same thing happens because there's too much fluid pressure around the nerves, which also affects them. Can everyone hear me okay? Okay. So there's some things you can do to prevent this type of pain. One of the initial things that we do in the office is to try to get you on the right track as far as making sure you're taking the right kind of supplements and vitamins. Typically, instead of starting you on the really strong medicine that has a lot of side effects, that makes you really drowsy or sleepy, makes you not want to do anything and all that, we try to give you something that's going to boost your energy some, and that's a B100 or a B complex vitamin. That you can get over the counter. It's something you can take every day, and it's going to help to kind of repair and rebuild any kinks or damages in the nerve to a point. This is for just very mild neuropathy. So if you haven't started anything and you have this kind of problem, that's something to take every day for a good nerve function. The other things is the alpha lipoic acid, which is also another vitamin you can get over the counter. That helps it. But just know that if you take more than the daily allowance, it's not going to help you have great nerve function. It's actually going to take away your nerve function and can trigger neuropathy. So you don't want to ever take more than what you need to. So the B complex, you shouldn't take more than 200 milligrams, and the lipoic acid, don't take more than 300 milligrams. So when you go to get the bottles, you just have to check that. Other treatments for neuropathy, like I said, are the over-the-counter medicines. There's ointments and creams you can get. Some people use capsaicin, which is over-the-counter now, and it's made out of cayenne pepper. It helps with the burning, tingling, shooting pains that you get, and it avoids you from having to take pills. Some people go for more natural or holistic type of treatment like acupuncture and reflexology, which is like a deep tissue massage to help trigger and release some of that nerve that is irritated. So for those of you who are diabetics in here, not everyone, I know there's a few of you at least in this room, the thing that you have to worry about diabetes in the winter is that you are going to have slower circulation, and that's not even diabetes, that's everyone in this room. Our feet, you can tell, of course, it's very cold outside, so the blood flow is much slower, and that's going to trigger more of a dryness sensation. You're not getting enough oxygen down to your skin, to your feet and legs especially. It can cause dryness, swelling, and scaling. So it's real important, especially right after the shower, that you guys moisturize then. Within 5 minutes is when you can lock in the most moisture to your feet and legs. After that, it's not as effective. So that's when your skin's the softest, and that's when you can allow more of the benefits of that lotion or cream into your feet. And 6% of this population around us has diabetes, and that number is still growing, and that's at least 6%. Some of you in here may have it and are not diagnosed yet, but some signs of that, you may notice you're having increased thirst, you may have dizzy spells, changes in your vision, changes in your habits as far as going to the bathroom and things like that. And those are early signs where you may have to go to the doctor and get checked out, or ask them sometimes to check your sugars in the 3-month and see how it's doing. So this shows you what a normal foot looks like versus an at-risk diabetic patient. In the normal foot, you have normal blood flow and normal anatomy structures. The blood vessels are nice and red. When you have a diabetic foot over a long period of time, you can have slower blood flow. There's not enough blood flow. The feet may look pale in color. They may get really dry. scaling, and you may notice discoloration, like a bluish tone to their feet sometimes. And because that blood circulation is reduced, it triggers some neuropathy or the numbness, and as a result of that, you can get pressure points like calluses or blisters, which can lead to the ulcerations that you can see on the bottom right of that picture. So we're going to talk about, most of the time when summer's gone and winter comes, the shoes that you wear that used to fit you last winter may not fit you this winter because some kind of changes happen to you. Maybe you've gained weight or lost weight, you have more swelling. When you go to pick a shoe, you want to get a shoe after your foot is measured. Best time is in the afternoon when you've been on your feet, when they've been the most worked, your muscles have worked, and you're at your maximum point of swelling. And when you go, you want to get a shoe that fits you right then and there. You don't want to have a shoe that you have to break in or have to make, they tell you that, oh, it'll stretch or it's going to work, or, just give it a few days, because that's what triggers blisters and pressure points. And that's what gets you into our office to treat. So if you, at first it's always good to go get like a breathable shoe. If you can get a lace shoe, that can let you adjust according to your swelling. Most of the time a wider shoe is better depending on your foot structure, and something where you have room for all your toes. So not everybody has perfect feet. Some of us have, like I said, bunions, hammer toes, things like that. So you're not going to ever find a shoe that's your perfect fit. It's not reasonable to always go get a custom molded shoe that's molded just for your foot, unless you just have tons of money that you can do that with. But most of the time, we have to get a shoe that can adjust somehow to us, or get inserts that go into that shoe that will help accommodate for the different pressure points. So that's what I was saying about going in the afternoon and making sure that when you put that, even if you don't try on the shoe, if you put the shoe up to the back of your foot and you see none of your foot should go over that shoe, that means that shoe is way too narrow for you. The shape of your foot should stay within the outline of the shoe when you go to try it. Even if you have your socks on and just want to see and you're running in the store real quick, if it's going outside, it's way too tight. So your best brand is not the most expensive brand. It's going to be the brand that works best for your foot shape and your foot style. So some people may think Nikes are the most comfortable walking shoes they ever had, and you may not be able to fit into it. That doesn't mean you have to make it fit. You have to go find your best brand. New Balances are really good shoes that are made for people that have a little bit wider feet. Asics are also really good shoes. There's a difference between running and walking shoes. Running shoes, you have to get more flexible shoe. That way you're doing a lot more movement, and walking shoes have to be a little bit more rigid so you have better balance. So you have to find your go-to brand, and that's the one that you're going to use for years and years. Some people love Clark's, Echoes, New Balance. Those are some of our favorites to recommend in the office, and that pretty much can accommodate most any width. So walking shoes, like I said, they're going to have flat, a broader sole. It's going to give you flexibility, cushioning, and support, and it helps you with your balance as you go back and forth and do your daily routine. And most of the time people need a bigger walking shoe since your feet are going to swell during that time than you may need for regular dress shoes because you're doing more activity. Running shoes, people who have a low arch, you want to look for a straight shape kind of shoe that helps to control motion and it's going to stabilize your foot. If you have it into whichever shoe, but for high arches, make sure you look for a more curve-shaped shoe, and for a low arch, a straighter kind of shoe. So people have all sorts of problems when they come to see us, and there's always, no matter what you do with your feet, 75% of the time, some of us in this room will have a foot problem, no matter how good we are to our feet and with our feet. So it's just good to inspect your feet every day, check them, check in between your toes. If you notice something that you're just not sure about, instead of trying to pick at it, poke at it, asking your friends, we're right down the street. You can always come ask us and get our opinion before it gets too bad. Don't let pain set in before you come in. Things that we recommend you not do is take care of certain problems that get too deep, like ingrown nails. Sometimes they're going too deep into the corners. You want to make sure that you are cutting your nails straight across. Don't angle or go into the corners. If you notice, like in that picture, it's red, it's inflamed, it's irritated, you want to make sure you come in right away, because 95% of the time you're not going to be able to, release the pus and drain it out and cut out the toenail, because it's going to be way too painful. You're going to need an antibiotic, and especially being diabetic, you're 10 times more prone to infection than anyone else. So you just have to be really, really careful. And when you cut your nails, always cut them straight across. Don't cut or angle into corners. Follow the shape of the nail itself and just smooth it out or straighten it out. If you have a hard time cutting, if you have a hard time seeing, just use a nail file or emery board and don't use anything sharp. Fungal nails is where you start to notice changes in the color of your nails. They may start getting brittle, thick, splitting layers. You may notice your skin around getting peeling and dry, yellow. When this becomes too hard for you to handle, definitely come in and see us, because we can help you start oral or topical, which is brush-on treatment for the toenails. And the best thing to do with really thick fungal nails is always just file them down as best you can, but not too low where you cause pain or bleeding. Corns and calluses, we all somehow will end up with a corn. One bad shoe can do it, where you end up with a blister which turns into a corn or callus. Best thing to do with that is a pumice stone foot file. Don't ever try to cut or shave them yourself, because especially the angle that you have to sit at, and especially where the corn is, you can cause more damage than good doing it on your own. So tips for the winter that we have is definitely check your feet every day. Don't just check the top and the bottom of your feet, but check in between your toes. If you can't really see, just go up to a stand-up mirror, or like put a mirror right at your feet to kind of see if you see any changes. Even if you notice a little dark spot, that can quickly turn into an ulcer or a sore. So you want to get that taken care of right away. Any like changes or moles or lesions that you see on your feet, you want to check for the shape of them, the color of them, and the thickness of them. If any of those things change drastically or suddenly, you want to make sure you come in right away. We are able to biopsy, check it, make sure it's nothing that can be harmful to your body. Like I said, cut your nails straight across. Wear a shoe that fits. Don't try to make the shoe fit you. It should fit automatically when you're in the store the right way. Of course, all of us should be doing this. Wash your feet daily in warm, not really hot water. Use a soft towel to dry them, and in between the toes, especially in between the toes, because wintertime, as soon as we dry our feet, put our shoes and socks on, we're out the door. And if we don't give enough time, or we don't take enough time to dry well in between our toes, that can lead to a fungal problem, because fungus loves really warm, moist environments. And if we're not giving enough time for our feet to dry, that can trigger other problems. And like I said, moisturize immediately after the shower within 5 minutes. Other things that you want to avoid during the winter is avoid being barefoot. Always wear socks or some kind of footwear. And a lot of times I've noticed my patients will just wear their shoes and they're closed in, and it protects their toes during the winter, but they're not wearing any socks. If you don't wear socks, all that moisture, all that sweating and perspiration that happens in your feet are getting reinfected into your feet. The socks help to dry up the moisture or wick away any moisture and help to keep the fungus level down in your shoes and your feet. The other thing is, if you are in your house, and a lot of us have wood floors and things like that, you may get splinters or cuts and things like that. Socks and shoes always help, especially in the wintertime. Don't expose your feet directly to any heat or cold. That's like a lot of times people like to do foot soaks or heat massagers. Some people fall asleep in them. They burn the whole bottom of their feet. It becomes a very dangerous, sometimes life-threatening issue. So you have to be very careful to test the water. If you like to soak your feet, I don't recommend soaking it, but more than like 2 or 3 times a week. And that's if you're not diabetic. If you're diabetic, no soaking. Just remember, whenever you're in doubt and not knowing what to do, or if you have any questions, sometimes you can even call for quick advice. You can make an appointment. We can pretty much see you for any emergencies within 1 or 2 days, and we'll be glad to see you guys. So just come find us. Hopefully you don't need us, but if you ever do, you know where to get us. And that's my little baby. He was born. Now everybody responds right. He was born September 18th. He was 9.5 pounds, and he's the new love of my life. But if you guys have any questions, yeah, almost 3 months, just let me know. I'll be glad to answer them. So